genomics can help there, but only if these tests become available for all patients. And these tests are usually quite expensive and may be reimbursed by some insurance companies in other countries, but in most health systems in Europe are organized in another way, in a different way. And it's a more general health system, and everybody has good general health care, but expensive tests will never be reimbursed in Europe. So in the ideal world, yes, genomic testing would be great to have. And genomic testing, I mean testing cell-free tumor DNA in the blood, for instance, or doing specific genomic testing on tissue, on biopsies, for instance. But that will be, in Europe, not feasible to install. So ideally, yes, I am pro genomic testing, and that would greatly redefine risk groups and could possibly refine treatments, dedicate certain treatments, more intensified treatments to certain risk groups, but it's not feasible yet. So in Europe, what we do use is we've been using MRI for a very long time, and you can use MRI and targeted biopsies to much better define the local stage and grade of the tumor, and that has really already majorly changed what we do in clinical practice. On top of that, we have been using for recurrent disease and now also for primary staging, we have been using and have intensified the use of using PSMA PET CT. And PSMA PET CT has really changed the landscape. And I do admit, and that there is a similar problem that by using PSMA PET CT, we also redefine risk groups. And we also don't know exactly whether the redefined risk groups and the treatments we apply will really improve the outcomes of all those patients. But we are learning this, and we are learning this very fast. So I believe that with targeted biopsies, with improved imaging, that alone will have a more pronounced impact on the clinical care of patients, and it's going to be a little bit less expensive than doing genomic testing in all patients. On top of that, using also genomic testing may improve a little bit further the care for patients, but I think the real gain will be rather marginal. But that's for local disease and de novo disease. In the recurrent setting and the mCRPC setting, yes, there I believe that genomic markers will have a major role, already have, like BRCA testing, and will have a major role in the future. But since we're talking now about local disease and also de novo disease, there I don't think genomic testing will be quickly introduced in Europe, and the impact will not be major, at least in my opinion.